Ellen Stanley. I see a bunch of people standing up, but I'm not clear. Okay, no. Dr. Teen Hancock, and then I'm going to ask Lynn Olson, Courtney Miles. I think Thea Embers has already been through here, but I'm going to say her name anyways. Big friends. Jason O'Meal, Beth Jones. Doctor?
Thank you. Good afternoon, Senator Millett and Representative Cornfield, members of the Joint Standing Committee on Education and Cultural Services. My name is Dr. Teen Hancock from Portland, and I'm here to testify in support of LD 798 as a family physician practicing at Martins Point in Gorham, also as the school physician for Gorham Public Schools and a parent of 3 children. We've heard a lot about vaccines and how they are considered one of the greatest public health achievements of the past century, so I won't get into that too much. But I do want to talk a little bit about my experience in practice and as a school doctor. In my practice, I've been surprised by how many patients and parents have been hesitant to immunize. I've spent many hours counseling them on the benefits and relatively rare side effects of vaccines. Many of them feel the vaccine debate has 2 equal sides, despite the clear and overwhelming data in support of vaccine safety and efficacy. The existence of exemptions for philosophical and religious reasons sends a mixed message about their importance. I believe that repealing these exemptions would do more to improve vaccine rates than all the counseling I do. In my role as a physician advisor for the Gorham Public Schools, I have seen firsthand the threat that vaccine-preventable diseases pose to our community. Over the past few years, we've seen an increase in cases of pertussis in our schools. Over that same period, immunization exemptions have grown from a handful of students to currently 46 elementary school students. This increase in non-immunized students threatens herd immunity, which puts everyone in danger. When I reached out to our school nurses to let them know I was coming to testify today, I received a swift response. Within hours, I had written narratives from each of them in support of this bill. I'd be happy to share those with you as well, but I'll just highlight a few. The message, though, was unanimous. We need clear, strong immunization policies without gray areas, such as philosophical and religious exemptions. As one of our nurses stated, the allowance for these exemptions has left it wide open for any reason to be given without a physician's input. Some of the philosophical reasons, they range, but some examples listed by parents include, it is my right and because I can. No discussion is required between providers and parents. Furthermore, the nurses spend hours of their time chasing down families who fail to provide vaccine records at the start of school. Our nurses shared with me their concern that some parents are filing exemptions as a convenience so their child can legally attend school rather than have to follow through with completing vaccinations. As a parent of a first grader and 2 children in preschool, this issue is also of personal importance. When I send my children to school each day, I want to trust that they are entering safe, nurturing learning environments, not ones vulnerable to diseases that should never step foot in our schools. Vaccines have been proven effective and safe time and again through a robust body of medical literature. That philosophical and religious exemptions lead to lower vaccine rates and decreased herd immunity, leaving our children at risk. On behalf of my family, my patients, the Gorham school nurses, and the community we serve, I urge you to consider repealing these exemptions and help make our schools safer for our children. Thank you.
Thank you. Are there any questions? Senator Pouliot with a question.
Hopefully for the work session you can get some information, but I'm just reading a report right now on the resurgence of pertussis, and you were talking about it in your testimony, and the report says that there's a recent resurgence in pertussis being associated with waning immunity over time in persons who received the acellular pertussis vaccine, which is administered as part of the DTaP vaccine. So can we get some data on, the effectiveness of this vaccine at all? I mean, if we're going to require people to stuff this into their kids, is it even going to make a difference? I'd like to know. Thanks.
Sure, and I'd be happy to provide some of that information. I think the idea here that I was trying to highlight is that while vaccines are not perfect, that no vaccines are 100% effective. The idea is if we have enough kids vaccinated, and the number is somewhere between around 95%, we create community immunity and herd immunity. So even if each vaccine doesn't 100% protect each child, we're creating immunity that helps protect all children. But I'd be happy to get some of
Any
that,
other questions?
those studies.
Thank you. Appreciate that. Jane Champagne?
I almost going to say good morning, but we have a little bit yet. Almost. So good evening, Senator Millett and Representative Cornfield and members of the Joint Standing Committee on Education and Cultural Affairs. My name is Jane Champagne. I'm a registered nurse. I reside in Waterville and I work as a school nurse. I've been a school nurse for 25 years. I'm here to testify in support of LD 798 as a school nurse, but also as a grandmother of a child with leukemia. His name is Bryce, and he's immunocompromised due to his ongoing treatments for leukemia. One of my roles as a school nurse is to track immunizations of students, to maintain lists of students who have not received the required immunizations for school entry. When I first started as a school nurse in the early 90s, there were a few students with medical exemptions and a couple of students with philosophical exemptions. The number of philosophical exemptions has increased exponentially in recent years. I've served on the executive board for the Maine Association of School Nurses, and school nurses across the state accept physicians' statements for medical exemptions. I have not heard of anybody not accepting a statement from a physician. We get notes from doctors just saying it is medically inadvisable for Jan Smith to receive immunizations, and that is accepted for the schools. The CDC declared measles eradicated in the United States in the year 2000. Now, 19 years later, we are seeing outbreaks of measles across the country. Measles in immunocompromised patients bear serious complications, with pneumonitis as the principal complication, accounting for the most measles-associated deaths. Every child has a right to an education in a safe environment, and these include children like my grandson, Bryce, who received all of his childhood vaccinations, but lost immunity due to chemotherapy treatments for leukemia. His compromised immune system puts him at dangerous risk if exposed to communicable diseases. He has suffered through treatments for nearly 2 years since he was diagnosed. His young body has fought the toxicities from chemotherapy, and he continues treatments today. Sorry, this is very emotional for me. Bryce has never complained about all he has had to endure. His only wish is to be able to be normal as he possibly can. One of the key components for his psychological health is the social aspects that school provides. He goes to school the day after he receives intrathecal, which is chemotherapy, into his spinal fluid, and again via his port, because his desire to be normal is that important to him. If there is even one student with one of the vaccine-preventable diseases, he will not be able to attend school for an extended period of time. He depends on community immunity to keep him safe. All students who are not fully immunized will also not be allowed to attend school for extended periods of time in the event of an outbreak. And there are hundreds of children in Maine battling cancer. And cancer is only one of the conditions where students have compromised immune systems. As community immunity can alleviate some of the challenges for children with poor immune systems, public policy plays a critical role in achieving the high population vaccination rate needed to achieve community immunity and freedom from disease. Maine citizens support civil liberties, but concurrently demand state protection of public health and safety. Do you want me to stop?
I need you to wrap up, please,
Okay.
yes.
The arguments of personal freedom of choice is understandable and carries heavy weight in our great state, but one of the principles of civil liberties is that a person's freedom does not justify infringing injury on others. Thank you for your time. Are there any
Thank you.
questions?
Any questions? Thank you for your testimony.
Thank you.
Maureen Sturdivant?
Good evening, Senator Millett, Representative Cornfield, and members of the Joint Standing Committee on Education and Cultural Services. My name is Maureen Sturdivant, and I work and live in Portland. I'm an attorney in Portland, but I'm here today to testify as a parent, a mom. My son, Sam, is about to start kindergarten this year. He's 5. He's currently unvaccinated for measles, mumps, rubella, and varicella, and I'm here to testify in support of LD 798. And let me tell you why. You have my testimony, my written testimony in front of you. I'll try to condense and keep things moving along. Short story, Sam received a liver transplant after surviving against all odds as a 1-month-old baby at Boston Children's Hospital. He was the second youngest child to receive that liver transplant at the time. As a result of that liver transplant, Sam is immunocompromised. You've probably already heard today that organ transplant recipients are required to take medication daily to enable their body to maintain that organ. Because Sam's transplant occurred when he was so young, he was never able to receive his regular vaccinations. He's now fully caught up to the extent medically possible. However, he is one of the medical exemptions in this case. Because measles, mumps, measles, the MMR vaccine, and varicella are live vaccinations, he will never be able to receive those. In short, he's not only vulnerable to these vaccinations or these communicable diseases because he doesn't have the vaccination. Because he's immunocompromised, he's even more vulnerable. If he gets them, which he's more likely to do so, he'll get sicker. His body won't be able to fight them as much. Boston Children's transplant team is amazing. They are #1 in the nation, if not the world, as far as the medical science they provide. They also provide amazing parental support. They tell us that we transplant kids so they can live, not supposed to live in a bubble. You need to have a reasonable, normal life. But when they talk to us about measles and chickenpox with Sam, excuse me, they tell us to run and not walk with no hyperbole whatsoever if we suspect that there's exposure to him. Defer to all the medical professionals you've heard today about the increased risk and the potential harm, not just during an acute infection if he survives, but the long-term impacts that might have on him. My husband and I live a balanced life. You have to live your life. We engage in a daily analysis of risk benefits, and some decisions are more easy than others. We don't go to the Children's Museum. We don't go to indoor trampoline parks. We find other things to have fun. I don't believe we should be forced to engage in this analysis when we're sending Sam to kindergarten. When Sam was initially sick and had his transplant, we was overwhelmed by the support of the community near and far that came up to support us. I believe that being part of a community, large and small, requires compromise to a certain extent. As other attorneys, and as I'm sure you all are aware, have testified, our government recognizes this compromise in order to engage in our community. There's an inherent balance that's needed in order to accept the conditions of our government as opposed to those who assert an absolute liberty. I'm confident that when you consider the evidence before you and take into consideration the needs that have been set before you, will vote in support of LD 798. Thank you.
Thank you.
Okay.
Betsy Smith? Amy Fenton? Okay, before I call up the next round, Elise Ornella, Tom Reynolds, Emily Hynes.
Emily Hynes is here.
These are people to come in and sit in the front row. Elise Ornella, Tom Reynolds, Emily Hynes. I think Tom Reynolds was already spoke. Elise Ornella, Emily Hynes, Stanley, I don't believe Stanley is here, actually. Michael Hoffman and Berkeley Almond Hunter. Okay, so next up is Lynn Olson. She's already gone. Courtney Miles.
Senator Millett, Representative Cornfield, and members of the Education and Cultural Affairs Committee. My name is Courtney Miles. I am from Yarmouth. I oppose LD 798. Before I start, I have to say that it is alarming that people are testifying with the assumption that all kids with exemptions have not received any vaccines, or that these kids are running around carrying all these diseases. This is just not logical. Also, it confuses me if doctors are opposing expanding medical exemptions. How much faith do they have in themselves, yet require me to trust them with my child's life? My family has been in Maine since before it became a state in 1820. I'm a licensed clinical social worker at Maine Medical Center. Therefore, LD 798 would require me to get any and all vaccinations indefinitely. Without informed consent, it would be unethical for me to take part in these vaccinations. Thus, I would be forced to leave my job. My children, 1-6 and 1-2, have received 47 and 32 CDC recommended vaccines, respectively. They would also not be able to attend daycare or public school. I am in no way, shape, or form equipped to homeschool. Thus, I honestly have no idea what we would do for their education. I do not want to leave Maine, but we have no options. My children would also not be allowed to attend college in Maine, making it very unlikely that they would ever return. My children will be reminded their entire life that they are a victim of vaccine injury. As a professional in the mental health field, I can only imagine the trauma this would cause my children to pull them from the only thing they have ever known, including their daycare and school. Our family has recently bought land where we plan to build our forever house. This is another thing this bill will take from us. Leaving the state would not just be leaving behind my entire life history. It would mean pulling my children away from over 100 of their relatives. It would also mean that my spouse, who has only ever worked for his family's excavating business that has been in our town for over 40 years, would also leave his job. Knowing that the plan is for him to continue running the company when his dad retires, our move would, without question, shut this company down, putting 40+ people out of jobs. I would also be walking away from and closing down a private counseling practice that I run, which supports caregivers of people with dementia. I am one of only 2 clinicians that I know of in the state that has a private practice devoted solely to this population. Just in my life, this bill will have a ripple effect to hundreds, probably thousands of people who don't even know this is happening right now. After 400 hours of research on this topic, I am anything but a complacent mom. And to note, the state allows my child's doctor to give him vaccinations, but does not allow her to write exemptions, even if she wanted to.
Are there any questions? Thank you for your testimony. Courtney Miles?
That was me.
Oh, sorry. Thea Embers? We had her earlier. O'Meal, I believe Mr. O'Meal are from Wilton. Beth Jones?
Senator Millett, Representative Cornfield, and members of the Education and Cultural Affairs Committee. My name is Beth Jones, and I live in Dresden. I request you oppose LD 798. This bill is a one-size-fits-all vaccination mandate that fails to respect religious sovereignty. Our responsibility is to defend the human right to exercise religious freedom for ourselves and our children. In this exercise, there should be no fear of legislative discrimination through denial of education, employment, or other societal sanctions. The belief that we are divinely protected, guided, and healed by only one source is a fundamental basis of faith. These perspectives recognize that faith and conscience compel an individual to submit first to the proper jurisdiction of divine authority. Who amongst us has the moral authority to deny anyone the right to pray for guidance and obey religious conscience? For those of us convicted by faith, vaccines raise many problematic issues, such as interspecies mixing, mixing of blood, violation of kosher law, injection of live viruses, and issues related to abortion. According to the CDC Pink Book, at least 27 vaccines contain cells, cellular debris, protein, and DNA from one or multiple of the following: cows, monkeys, chickens, pigs, or aborted fetal cell lines. The presence of these components makes certain vaccines unacceptable for members of various faiths. The Establishment Clause requires religious accommodation when the state offers a secular exemption. Providing a medical exemption, but excluding a religious one, disfavors religion, thus violating the strict governmental neutrality required by the First Amendment. This bill will be a precedent setter for the silencing of religious sovereignty this state and country has been built on. The government labels vaccines unavoidably unsafe and releases manufacturers from liability. As such, wouldn't the government itself be creating a third-party harm, a harm to the greater good, violate its police power, and not be considering the best interests of children by mandating something unsafe by its own admission? If we don't have the right to make choices guided by religious sovereignty, we're really not free in any sense of the word. Please stop this dangerous bill from infringing on religious liberty and oppose LD 798. Thank you.
Thank you. Any questions? Thank you for your testimony. I have lost where I am. Okay, Stanley Shelliff, Dustin Sulak, Michael Hoffman, Berkeley Alman Hunter, and Andrew Alman Hunter. Please come to the front. I don't know. I've lost track. Just give me a second. I'm having a mental breakdown. Bear with me. Okay, I think, so, did I call you guys up? No. Did I call? Oh. Emily Hynes. Okay. Okay, great, I found you. Emily Hynes, why don't you go ahead up?
Hi, good evening, Senator Millett, Representative Cornfield, and members of the Joint Standing Committee on Education and Cultural Services. My name is Emily Hynes, and I'm a resident of Westbrook. I'm here to testify in support of LD 798 as an emergency room nurse of 12 years, the mother of a toddler, and a new nurse practitioner. I originally wanted to stand here and tell you about how my family has been personally affected by philosophical exemptions and to refute vaccine myths that we have all heard. But to be honest, the teenagers who were here earlier today have blown my mind and have been much more articulate and poignant than I could ever be in those points. So I will just tell you from my personal experience as an emergency room healthcare professional. I feel like I've been transported to a world where vaccines are more dangerous than the diseases themselves, which it is not. I've grown increasingly more frustrated listening to these testimonies because it's become painfully clear that not one of the people in opposition has actually seen a child suffer and or die from one of these preventable diseases. And I have. I've seen children die from rotavirus. I've seen children die from pertussis. I've seen people die from bacterial meningitis. And I've seen a few children have measles when I worked out of the state. These are not innocent diseases. These are dangerous, and they're fatal. I've also seen vaccine reactions, and they do not compare to the diseases themselves or the effects they have on these children. One of the things that has made me react in all these testimonies is that my child, my choice. I've watched these children die, and they did not get a choice in this matter. They were victims of the choices of other children's parents. And we don't live in a bubble, we live in a community, and our choices have implications for others in our community. For our children, their community, a majority of it is their schools. So they spend so much time in their schools. So our choices have implications for other people, and in the case of vaccines, the implications are a threat to public health. We cannot afford to risk the health of our community because of the unfounded fears of a few. Thank you for your time.
Thank you. Any questions? Thank you. Melissa Howard? Oh, I thought I heard Melissa Howard. No. Oh, I'm losing my mind. What are your names again? Melissa Howard. Okay, it's late at night. I'm here messing with my mind.
I'm going to get you out of here fast. I promise you that. So, good evening, Senator Millett and Representative Cornfield and members of the Joint Standing Committee. My name is actually Gill May, and I'm speaking on behalf of Melissa Howard of Biddeford. I'm from Portland, so our stories are tied together, and I hope that's acceptable. I'm here to testify in support of LD 798. Melissa Howard, who is listening in from home right now, hey Mel, is the director of a large daycare in Westbrook, which my son Thomas attends. Last year, when Thomas was 5 months old, he and 4 other children contracted chickenpox. Thomas was vulnerable because he was too young to be vaccinated, and he got really sick. He got pneumonitis in his lungs. He was sick for about 2 weeks. And Melissa's niece, who also attends our daycare, was also extremely sick. Chickenpox is a big deal in little kids. Melissa had to call 22 families herself and tell them to pick their infants up immediately and not return to daycare for 21 days until the CDC declared that the outbreak was over. Many parents arrived angry or crying, including single mothers wondering how they'd find daycare or go without income for 3 weeks. My husband and I wondered the same thing. There are real consequences when families choose bad science over public health. Our daycare lost $24,000 in income while 22 families were furloughed for their safety. Melissa had to cut staff hours, and we worried about how our caregivers would pay rent and whether our daycare would be still standing at the end of this disaster. Baby Thomas has a right to a safe education. We're not doing this again with measles. I shouldn't have had to carry my baby like a bomb through an urgent care, worried that he could sicken or kill someone with a weak immune system. You can decide for yourselves if you believe the bad science and misdirections you've heard from the people who oppose this bill tonight. I believe this bill is about baby Thomas's right to an education free from preventable disease. I hope that you'll stand with babies like my little bubs at home, sick kids like Matt Hogenauer, and those who can't protect themselves, and vote ought to pass on LD 798. Thank you.
Thank you.
Any questions?
No questions, thank you. Okay, Dustin Sulak, and as you approach, Deirdre O'Neill, Jessica Shaw, Aaron Moscheid, Jennifer Sargent, and Regina Creeley. Please come to the front row so I can see that you're here. Thank you. Jessica.
Good evening, Senator Millett, and the impressively enduring distinguished members of the committee. My name is Dustin Sulak. I'm an osteopathic physician licensed as a general practitioner here in Maine. And my professional areas of focus are integrative medicine, which is the combination of complementary alternative medicine and conventional medicine, and also medical cannabis. And I'm widely respected as an international expert in this field. I speak locally at the Maine Osteopathic Association Conference, Maine Academy of Family Practice. And because of my areas of focus, my practice attracts people that have been refractory to conventional care. They've failed to respond to conventional treatments. They seek me out for experimental treatments. And because of that, I spend a lot of time going to the primary literature to understand the risks and benefits of experimental treatments in my patients. I'm here to oppose LD 798 today, and I'm not going to read through my testimony. I'm just going to give a few highlights and answer some of the questions that I've heard. I think even at this late hour, I have some nice surprises services for you all. So first of all, I just want to highlight some issues of medical ethics from the AMA Code of Ethics. Point number 3, a physician shall respect the law and also recognize a responsibility to seek changes in those requirements which are contrary to the best interests of the patient. And number 8, a physician shall, while caring for a patient, regard responsibility to the patient as paramount. And I think you've heard a lot about informed consent and medical ethics today, and I'll leave it at that. Using legal force to circumvent informed consent violates medical ethics. So a few things that I want to address, because it is a little confusing to hear such controversy amongst my field. You know, I'm surprised that the Maine Osteopathic Association and the Maine Medical Association so strongly oppose LD 987, which would give physicians more authority and more power to look out for the best interests of their patients, and to support a bill which would remove that. I want to begin by showing this document, which is the rules, Chapter 126 and 261, that pertain to immunization requirements for school children. And just to clarify the strict criteria on medical exemptions. So what I'm describing now refers to measles, mumps, and rubella. There's 4 criteria for medical exemption. 1 is pregnancy. 2 is known altered immunodeficiency, such as tumor, congenital, and long-term immunosuppressive therapy. Number 3 is anaphylactic reactions to eggs or neomycin. And number 4 is anaphylactic reaction to measles, mumps, or that vaccine. So basically, you're either pregnant or you've had a life-threatening illness. That's the only way to be exempt from some of these required vaccinations. Now, I think part of the surprise that I have for you is the answer to the question of, do unvaccinated children pose a higher threat to the public than the vaccinated? The written testimony that I submitted is highly referenced with peer-reviewed literature. I want to just begin by describing some of these required vaccines. Tetanus, for example, is not a communicable disease. You can't catch it from anyone. You catch it from a puncture wound that's infected with spores. The IPV vaccine, the inactivated polio vaccine, cannot prevent transmission of the polio virus. The citation is from the New England Journal of Medicine in 2007. Of course, the oral polio vaccine, which has been phased out, did prevent transmission, but the current polio vaccine only prevents the expression of the symptoms. It can still be carried and transmitted. While intended to prevent the disease-causing effects of the diphtheria toxin, the diphtheria toxoid vaccine is not designed to prevent colonization and transmission, again, only to prevent the onset of the disease and the symptoms. So these children that have lacked or gained vaccination one way or another have no difference in their rate of threat to the rest of the population who has received the vaccine or maybe who hasn't. Other examples include hepatitis B, which is a blood-borne infection, and most of our children at school are not being exposed to bodily fluids, and I don't think that this is really applicable. So the broad language of this rule really includes a lot, it's just too broad, and it includes vaccines that don't need to be mandated. And so I'll just summarize here. LD 798 and any legislation that would use legal force to essentially mandate a medical treatment violates medical ethics. The safety and risks of vaccination are not fully understood. There's a high rate of emergency room visits after childhood vaccinations. Vaccination is not always effective.
Yeah,
And
you
many
really
of the
need to wrap up.
last point, many of the vaccinations that would be mandated by this bill have no impact on the safety of the general public and should remain a personal choice.
Great. Thank you. Are there any questions? Thank you very much. Stanley Shelliff from Portland. Michael Hoffman. Berkeley Almond Hunter or okay, great. Okay.
Good evening, Senator Millett, Representative Cornfield, and members of the Joint Standing Committee on Education and Cultural Services. My name is Berkeley Almond Hunter, and I'm a resident of Hallowell. I'm the mother of a 2-year-old child, and I'm here to testify in support of LD 798. Kennebec County Schools, which my daughter will attend, have vaccination rates that are below the community immunity threshold for Tdap and close to the threshold for MMR. I hope to have another baby soon, and I worry about that child's safety when he or she is too young to be vaccinated, since our community does not have sufficient vaccine coverage to prevent outbreaks. You're hearing testimony from parents on both sides of the debate tonight, and I really believe that everyone's intentions are coming from the same place. We all really want to protect our children. It's true that there are risks to vaccination. I am a data scientist by profession, aka statistician, so I'm going to make my case with numbers. According to the CDC, the odds of a child having a severe reaction to common vaccines are less than 1 in a million. In comparison, the odds of dying in a car accident in any given year are about 1 in 8,000. The odds of dying in each 100 miles of driving are 1.25 in a million. So anyone who drove here from Portland today is more likely to die on their drive to and from this hearing than have a serious reaction to a vaccine. To throw in a classic cliche, the odds of being struck by lightning, according to the National Oceanic and Atmospheric Administration, are 1 in 13,000. You are 77 times more likely to be struck by lightning than to have a severe reaction to a vaccine. I'm not listing these statistics to be morbid, but to point out the relative safety of vaccines and serious danger of outbreaks of preventable diseases. Life is inherently risky, and we must use the credible information that we have to make decisions that maximize health and safety in our community. The overwhelming majority of the medical community, all major health organizations, and medical research scientists have stated and proven over and over again that vaccines are safe and effective. I urge you to seek information from medical experts, not social media, not fringe websites, and not newspapers. When parents decide not to vaccinate, they put the entire community at risk, especially our most vulnerable. Spreading preventable diseases is not an inalienable right. I urge you to consider the safety of not only my child, but all children when you vote on this bill. Thank you for your time. Oh, also, my husband was listed right after me, but you have his written testimony, but he's watching our daughter. So.
Great. Thank you for letting me know. Okay, so the next round, we're going to be having Deirdre O'Neill, Jessica Shaw, Aaron Moshide? Moshide. And Jennifer Sargent, Regina Creeley. And then I would ask Alyssa, I think it's Goodwin from Brunswick, Ryan Donahue, Portland, Richard. What do you think that is? Sawyers?
Saucer?
Saucer?
Maybe it's Sawyer.
Saucer? Something from Portland. Guys, really. Lawrence? Ray? From Harpswell?
Or Guy?
Or a guy?
Is it in cursive?
I know.
Scribble.
Really encourage, if you ever come back up here again, you guys try to be a little bit more careful with your writing. And Sarah Hoffman. So, Deirdre O'Neill.
Okay. Good afternoon, more late evening. Senator Millett, Representative Cornfield, and members of the Education and Cultural Affairs Committee. My name is Deirdre O'Neill. I am 16 and live in Phillips. I oppose LD 798 because I am pro-choice. I am homeschooled but have been greatly helped by the local public school. I was diagnosed with dyslexia using testing provided by the elementary school. Because of this, I was able to overcome most of the roadblocks caused by dyslexia. I am also currently taking 3 classes that I need, 2 through the high school and the other an online college class. I am pulling straight A's in all my classes. Under LD 798, these opportunities would not have been available to me. Next year, I want to take CNA and plumbing classes at a technical school run by a local high school and continue taking online college classes. Later on, I want to go to college full-time to become an RN. If this bill passes, I will not be able to do any of this. If this bill passes, all my carefully laid plans and dreams will be crushed. If this bill passes, I will want to leave the state of Maine, which is very sad because I love Maine. If the goal of this legislation is to increase vaccination rates, you should take a closer look. The actual effect may be to marginally increase vaccination rates while causing a budget crisis in education because of student withdrawal and staff shortages in the already hurting healthcare field. I ask you to consider the fact that under the law, you trust me to choose to have an abortion without my parents' knowledge, but you do not trust me to choose whether or not to be injected with vaccines. The worst effect would be segregating citizens like me who have done nothing wrong by denying us an education. Please vote against this bill. Thank you for your consideration.
Jessica Shaw? Aaron Moshide?
Yes. I guess I'm number 132. Senator Millett, Representative Cornfield, members of the Education and Culture Affairs Committee. My name is Dr. Aaron Hoshide, and I live in Bangor, Maine. I'm a PhD faculty and sustainable agricultural economic researcher affiliated with the University of Maine, Orono, and teach at Eastern Maine Community College. I'm asking you to vote against LDL 798, and I'm also in favor of LD 987. So again, against the current proposed legislation, LD 798. I would like to make it clear that the testimony that I'm about to give you is mine alone, and I will defer the University of Maine system and other entities to what they've already testified. I stand before you today as an educator and academic researcher that strongly believes in critical thinking, teaching to a standard, and the essential need for scientific evidence and research to make rational decisions. To give you a more personal understanding of my take on this issue, my father was a civil engineer in Hawaii. I grew up in Hawaii for 10 years. I've lived in this great state for 20 years, and I hope I will die here. I love the state. I love the people I've met across all corners of the state as an agricultural researcher, visiting people on farm and establishing deep connections to people in the state. When I was a young child, I was diagnosed with childhood leukemia. And my father treated me with a very, at that time, unconventional treatment. That treatment was tropical periwinkle. That currently, more recently, has been approved and is the current orthodox medical treatment. That experience has, along with my father teaching me about Pasteur's colleague Bouchamp and the other side of that inextricably linked coin, that health is as much a factor, sleep, proper diet, in terms of is creating a healthy body environment to prevent disease. Our kids are great kids, and I've circulated materials about them, and I will not spend any more time. They have really good relationships with people in the schools, Orono, Greater Bangor area, Bangor. They're model citizens. They do not get sick. They are extremely athletic, and I will leave it at that. The thing that I would like this committee to consider is very, very specific. The benefits of marginally increasing vaccine rates from 95% to a projected targeted 94%, so a 4% increase. We've heard testimony of perhaps a $33 million potential, positive impacts by doing that. Negative consequences, difficult to say because of, how much that is the case. But the cost, vaccine injury, $15 million roughly to the school system by my ballpark estimate. Lost income from jobs and homeschooling, seasonal cost of jobs, lost businesses, and the multipliers that entail. loss of intellectual capital, and pain and suffering. So when you look at it from an economic cost-benefit perspective, it does not seem to me the marginal benefits exceed this long list of costs. I really appreciate the community's time, and as a lifelong Democrat, I would urge you to really critically evaluate this independently.
Thank you very much.
Thank you very
Any
much.
questions? Thank you very Jennifer Sargent?
She's not here.
Regina?
Hi. Good evening, Senator Millett, Representative Cornfield, and distinguished members of the Education and Cultural Affairs Committee. My name is Regina Creeley, and I am testifying in opposition to LD 798 and in support of LD 987. My residence is in Hudson, and I'm a retired special education teacher. In 2014, I was voted Special Education Teacher of the Year by the Maine Administrators of Services for Children with Disabilities. I taught for 30 years at Leonard Middle School in Old Town. The year before I began was 1983, and there were over 660 students. The halls were crowded enough to have upstairs cases and downstairs cases. There was one and only one special education teacher, and one and only one teacher's aide. There were no students who met the criteria to be designated mentally retarded. There were no nonverbal students. There were no special procedures for students who couldn't use the toilet facilities independently, because all the students were independent in the restroom, and in the cafeteria, and in the locker room. 30 years later, in 2014, things were different. There were only half as many students in the whole school. But even though there were far fewer students, instead of one special education teacher, there were 5. Instead of one teacher's aide, there were at least 10. In those 30 years, the nurses' list of students whose health conditions we had to sign off on went from 1 page to 33 pages. When I began, the cafeteria was crowded, and people ate peanut butter sandwiches and tuna fish sandwiches. 30 years later, no peanut butter nor tuna fish was allowed anywhere near the school. For my first dozen years, there was no autism. But then the numbers steadily grew, along with the inhalers, EpiPens, and children needing insulin shots, children who were nonverbal, and children with multi-page medical plans. When the special education budget began to increase to meet the needs of kindergarteners with intense needs, I asked, what on earth is going on? It was a long and troubled journey over the years teaching students with greater and greater special needs. The many books I have read on the burgeoning problem of childhood illnesses are very troubling. It is very troubling that special education budgets keep increasing and increasing and increasing. And one has to ask the question, why? I've included a list of books that I've read, and I think a very important article on that this is the sickest generation. Thank you.
Thank you. Any questions? Thank you for your testimony. Okay. Elisa Goodwin? Ryan Donahue? Richard something. Saunders? Okay. Are you a doctor?
I'm not.
It looks like your signature looks like you are.
Thank you, Senator Mellett and Representative Cornfield. And thank you, esteemed members of the committee. My name is Richard Saunders. I live in Portland, and I'm here to speak in favor of LD 798. I'm the proud father of 2 young kids, young vaccinated children, who will be entering public school in a few short years. I'm a firm believer in the scientific method. I believe science has made our food safer. I believe that science has made our water safer. I don't have enough time to catalog all the ways science has improved our lives and made us safer. I also believe that the sound scientific research behind vaccines has made us all safer. I absolutely believe this legislation will make our schools safer. I'm terrified at the prospect of a preventable infectious disease spreading through any school. You, the members of this committee, have the opportunity to make our schools safer. The resounding majority of Mainers with school-age children have chosen to vaccinate their children. I believe it's over 92%. All of those parents of our youngest Mainers trust the science that vaccines help protect their children. You've heard from a lot of passionate parents here today. I want to remind you that many parents who believe in the safety of vaccines couldn't be here today. The silent 92%. I want you to think about the single parent working hard to support their children who couldn't be here to testify in support of this common sense legislation. They are among those that have the most to lose if their child's school is closed because of an outbreak. The silent 92% of Maine parents have put their trust in you, our elected officials, to review the science, understand the issue, and make an informed decision. I, for one, will continue to believe that science has made our lives better and that vaccines protect us. I ask you to do the same. I thank you for your time and consideration of this important public health issue. And I welcome any questions. Sorry.
Thank you, Mr. Saunders. Any questions? Thank you for your testimony. I'm going to go with Lawrence Ray Bay from Harpswell.
There you go, get up there, fella. There we go. He is a doctor, that's why you can't read it.
And I'm sorry, what's your last name?
Losey, L-O-S-E-Y. But by the way, I don't write prescriptions anymore. They're all on the computer. There's a reason for that. I would like to thank the honorable, hardworking, and long-suffering members of this committee. I would like to suggest that we take about 10 seconds. Everybody just stand up. Here in the room, come on. I don't like deep vein thrombosis. This is worse than a transatlantic flight.
It actually is worse than a transatlantic.
That's right. Well, thank you. They suggested that I should, what? They suggested I should wear a white coat. I found this one in my closet. I haven't worn it for 5 years. The hospital went out of business 3 years ago, but it's got my name on it. Okay, I have had the pleasure of practicing in Brunswick, Maine for 40 years. I live just across the peninsula from Brownie, and I love it here. And I'm a pediatrician. I did my residency at Maine Medical Center. I was born in the barrios of East Los Angeles. However, I have an ancestor that was Governor Bradford way back. So I came home. I've been very interested in vaccines and have worked with the Maine vaccine program for 25 years. I've received awards from the US CDC, the Maine Vaccine Program, the American Academy of Pediatrics, the Maine chapter of Pediatrics for my vaccine advocacy. I'm currently in my 8th year of a 3-year term on the Maine Vaccine Board. There's an issue with getting new members reappointed. Anyway, there's been a lot of discussion this afternoon, evening, morning, about the science. I'd like to take a couple minutes on some questions that I have heard, some things that have not been well addressed. We've talked a lot about immunization rates, the 95%, the 93%. There are differences in methodology. The national comparison rates are from the immunization program from the CDC, doing a survey of several hundred Mainers and extrapolating from that. The wide confidence range in that numbers makes it really difficult. Yes, we say we're 17th on the list, but there is very little statistical difference between the top and the bottom, and there are significant changes year to year. So, we have to have a little bit of caution in interpreting those numbers. Another comment that I heard earlier this evening was about use of vitamin A and vitamin D as effective treatment for measles. In third world countries where children are malnourished, undernourished, there is a significant benefit from using vitamin A, and improves the mortality rate. It doesn't apply in the U.S. because we don't see kids coming in with the tremendous vitamin A. Measles is one of our biggest concerns here because it is very highly infectious. If you were to walk into a room where someone with measles had been 2 hours before and you were susceptible, there's over a 90% chance of getting measles. Smallpox, chickenpox are in that same range, but they're way above the others. Pertussis requires considerably more exposure. We've got problems with the pertussis vaccine, so we have. About 15 years ago, I forgot to check the exact date, we changed from the DTP vaccine to the acellular vaccine. We saw severe reactions fall by 90%. You heard people earlier this afternoon talking about horrible reactions to pertussis vaccine. That was the old vaccine. The new vaccine doesn't work as well. And we're seeing shorter time of immunity, less effectiveness. It still is effective at reducing it, but I think the hook is about to come out. Thank you very much. I had some stuff in my testimony. Thank you.
I know, I'm sorry.
Oh, sure.
Has a question for you.
Yeah, I do, about the last piece that you just said about the hook is going to come out.
Question.
Yeah, this is where I'm trying to formulate my question here at 12:05 in the morning. Just give me a second. So what I want to know is, if we as a legislature say, thou shalt do this to send your kids to public school, how do we know that it's going to make a difference? I mean, I'm not sold yet that it's going to make a difference.
Okay.
I probably won't get there, but I would like to have at least more information before making a final decision about the fact that this is even going to move the needle. So
that's a very legitimate question. I think that if we can get the immunization rate for pertussis higher, we will see fewer cases. We're way up there in the U.S. for the number of pertussis cases. That can be brought down. Our biggest concern right now is with measles. And we haven't had any measles in Maine since 2017, and that was imported from another country. We can now track back and tell you what country every case of measles came from in the U.S. But that's the one that I'm most concerned about. But pertussis, I'm sure it will help. It will not eradicate it. I just heard, I haven't seen the official announcement, that the Tdap vaccine given for teenagers has been approved to give a second dose. That will help. How exactly we're going to use it, I don't know. Those recommendations are coming. The other thing is, at the end of my testimony, I left my cell phone number and my email address. Please feel free to send me a question if you have it, and I'll do my best to answer it or find more information.
Just so everyone knows, the public testimony gets put on the website, so everyone's going to have your cell phone number now.
Okay. I'll tell you, though, that I don't answer it when I'm in the office.
Thank you, Dr. Lucy. Any further questions? Okay. Sarah Hoffman, and then after Ms. Hoffman, there will be Jackson O'Neill. Jackson, you got to work on your handwriting as well. Sorry. That was one we were struggling with. And Jamie Robertson, McIntyre, Malcolm Holmes, Megan Fredrickson, and Ashley from New Sharon.
I can go. Hi. Good evening, Senator Millett and the rest of the members of this amazing committee. I have newfound respect for what you all do. Thank you for what you do. My name is Sarah Hoffman, and I am a resident of Freeport, Maine. I am here to testify in support of LD 798 in opposition of LD 987 as a parent of 2 young children and as a pediatrician. First, I must comment that many of the things that I have heard from the opposition are not based in fact. I could break them apart, but it's 12:05. I worked all night last night, and I've been here all day, so I'm pretty exhausted. But there's been a lot of commentary that is not based in reality or fact, and all the pediatricians who have been here can attest to that fact. Public schools must be a safe place for our children to learn, all children. I've seen and cared for children right here in Maine who have become critically ill and permanently disabled by diseases that should have been prevented by vaccination. I have cried with parents of children who are on ventilators, fighting for their lives from vaccine-preventable illnesses. And words have utterly failed me when they ask, what could we have done? To watch an infant struggle to breathe or a child's body fail them, succumbing to an illness we know how to prevent, is something I struggle to even discuss, obviously, and affects me to my core. As pediatricians, we do our very best every day to help patients and their families live their safest and healthiest lives. I understand the fear some parents express. I know that it's hard to trust others, and that most of the opponents here are fighting for what they think is best for their children. But I feel it is my duty as a physician to advocate for mandatory vaccination because I know the facts, I know the evidence and the science, and for that reason, I vaccinate my own children according to the CDC schedule. Unless there is a medical contraindication, ensuring that children are immunized as a condition of school entry is common sense and critical for protecting our public schools and the population of Maine in general. We cannot allow misinformation and fear to drive our policies that will have negative impacts on everyone's health and safety. We need to allow evidence and truth to guide us. In my opinion, there is no other medical intervention that has had such a profound positive impact on the health of our global population. This is not an individual decision that affects just the individual. It affects us all, and most importantly, the most vulnerable. Vaccines are safe and effective. So effective that when done at high enough rates that the opponents you are hearing from today likely do not fully understand what a world would look like without the benefits of the vaccines that we currently enjoy herd immunity from, and are fearful of that waning herd immunity, which is real. In addition to my full support of LD 798, I also want to express my opposition of LD 987. This bill would allow healthcare providers who do not learn medicine or practice evidence-based medicine to provide medical exemptions for vaccination. This is dangerous as it would allow people to subvert the efforts of LD 798 in permitting people without proper medical training to authorize exemption. Thank you for the opportunity to share my position in this important bill with you today. I'm happy to answer any questions.
Thank you. Thank you. Any questions? Thank you for your testimony.
Thank you.